Today we are going to be going over the GPRA data collection for the State Opioid Response and State Opioid Response Supplemental grants. We're going to be covering the GPRA implementation overview. We're going to then be covering how to do the GPRA in Qualtrics, and then we're going to talk a little bit about special populations. GPRA is the Government Performance and Results Act, which is an established client outcome instrument to measure the performance of government-funded programs like the SOR and SOR Supplemental Grant. Data must be collected on all individuals who receive SOR-funded treatment and recovery services. This includes SOR programs like Hope Not Handcuffs, jail-based medication-assisted treatment, Mission MyRep, mobile care units, opioid use disorder treatment, individualized placement and support, opioid health homes, peers and FQHCs, recovery houses, recovery services, and telecounseling. Starting in June 24, 2019, we received a directive from SAMHSA to begin the GPRA reporting tool. From there, providers entered the GPRA into the original Qualtrics link. After getting a change to the GPRA tool, we created a new link in November of 2019 where providers receive the new Qualtrics link and are entering the GPRAs. The Wayne State Evaluation Team uploads the GPRA data into SPARS, which is the federal database for the GPRA data. Providers continue entering GPRA into Qualtrics for the lifetime of this grant and all future grants with GPRA requirements. All treatment and recovery providers which receive SOR funds must implement the GPRA. The provider staff or volunteers at the treatment or recovery agency should be conducting the interview with their clients. The same provider, staff, or volunteer who complete the GPRA interview should be reporting the GPRA data into Qualtrics. So just to reiterate, the provider staff which implements the GPRA interview with a client must also be entering this data into Qualtrics. You can enter the data into Qualtrics via the web link provided by Wayne State and the Office of Recovery-Oriented Systems of Care. Now for an overview of the GPRA data entry timeline. We begin with a baseline and intake GPRA interview that should be completed within 48 hours of the program intake. For residential programs, the GPRA interview must be completed within 3 days of program intake, and for outpatient programs, the GPRA interview must be completed within 4 days of program intake. A 6-month follow-up GPRA should be conducted between 5 and 8 months after the intake. This is a window of 1 month before and 2 months after 6 months post-intake. For example, if a client receives the GPRA intake baseline interview on January 1st, the 6-month follow-up anniversary date would be July 1st. The window for conducting the 6-month follow-up interview would open 1 month before the anniversary date on June 1st and would close 2 months after the anniversary date on September 1st. Then the third interview is the discharge interview. This GPRA should be conducted on the day of the discharge from the program. If your program does not have a discharge policy, this GPRA should be conducted after 30 days have lapsed since the time of the last service. If a discharge GPRA is not possible, the clinician must fill out the administrative discharge for the GPRA. Administrative discharges do not count towards the 80% follow-up compliance rate. There's more information about administrative discharges on our website. And here's an overview of all 3 of the GPRAs. It's important to note that the discharge GPRA may come before the 6-month follow-up GPRA for more short-term programs. This is what we like to call our one chance rule. Provider staff must enter the entirety of each GPRA interview in one session on Qualtrics. You can't click in and click out and do it throughout the course of a day or throughout the course of a week. To highlight the 80% compliance rule, the federal minimum 6-month follow-up completion rate is 80%. This means that 80% of the individuals who completed an intake GPRA must complete a 6-month GPRA. Incentives are permitted for the completion of a 6-month GPRA follow-up interview, but cannot be given for an intake or discharge GPRA. Incentives may have a maximum cash value of $30. Many agencies are utilizing grocery store gift cards or Amazon gift cards for incentives. A few best practices for completing the GPRA. We recommend printing a paper copy of the GPRA to utilize with your clients. Answer the questions as they are written. Being literal can be the best approach. Make sure you're collecting and keeping collateral contacts for your clients so that you can access them for the 6-month follow-up. And keep a printed copy of your completed GPRA data in your client's secure file. Paper copies of the GPRA, as well as helpful ways to collect and keep collateral contacts for your clients, are available on our website, which is migiprainfo.org.
The second portion of the PowerPoint looks at how to enter the GPRA into Qualtrics. Once you try to enter a GPRA into Qualtrics, the first thing you're going to see is an overview of the GPRA process and a few different links to resources, including our website link as well as the email you should reach out to if you have any additional questions. The second page you're going to see, this information is not technically included into the GPRA tool, but it's required for tracking purposes. So you're going to need to input the PIHP or the grantee you are reporting for. You're also going to need to select the agency that you are reporting for. If for any reason your agency is not listed on that list, you're going to go ahead and select Agency Not Listed, and you'll be prompted with an additional box to enter that information. You are also going to need your facility license number. So this number begins with SAO. There is a link on the mygiprainfo.org website for those specific numbers. I would strongly recommend you keep that number easy to access because you will need it for every GPRA record that you enter. The next item on this page you're going to enter is the specific program that you are reporting for. The following page, this is still for tracking purposes, so this is going to ask the name and email of the staff member who is inputting the GPRA information. Please make sure that this email is up to date because this is the email address that's going to receive reminders to complete the 6-month follow-up GPRAs. The next page is very, very important. This is when the client information starts. So the very top thing you're going to see is client ID. It's important that this is a unique client ID, so this cannot contain any information that identifies the client. So it should not include anything like birth date, actual client name. It typically is going to be some combination of letters and numbers that are entirely random. However, you want to make sure that you keep track of this ID because when you go to enter in discharge or 6-month follow-up GPRAs for the client, you will need to use the same ID number. The next questions it's going to ask you are the client type, the GPRA interview type, as well as the GPRA interview date as well. One thing that's really important is you want to make sure that you select the correct GPRA interview type. If not, you're going to be prompted with the wrong questions. Another important component is making sure you enter the correct date for the GPRA interview. This is how we're going to determine when to send you the 6-month follow-up reminders. The next page is asking you for the client ID again. Like I said before, it's really important that we have client ID because this is the way that we can connect the intake record with the discharge as well as 6-month follow-up records. So this is going to be a second time where they're asking you to verify that ID again. If this ID does not match the ID that you entered on the initial page, you'll receive an error message and it will prompt you to go back and address the error. The next section of the GPRA is the Behavioral Health Diagnoses section. This looks similar to the page that you see in the actual GPRA tool. The next section, so the graphic you see on this page kind of outlines each portion of the GPRA interview. So if you do the intake, it's going to be about 117 questions. The discharge is a little bit smaller with 100 questions, and then the follow-up is the shortest with 89 questions. So this is the total of number of questions if we're not skipping anything. So if there are certain questions, as if someone isn't using a substance, then it's going to trigger a skip pattern to make these surveys much shorter. The other component to keep in mind when you're navigating through the Qualtrics survey is there are some green arrows. Those are going to help you go forward and backward in the survey. So if you realize you may have made a mistake, feel free to use the back arrow to fix it. However, you should note that depending on which screen you're on, you may not always be able to use the back arrow. Additionally, once you get to the end of completing the GPRA in Qualtrics, what you'll see is you'll have an option to save a PDF of the record that you entered. We strongly recommend that you save that PDF, and what you do to do that is just select Download PDF.
And to finish out our presentation, I'm going to touch on a few special populations of the SOR grant that may have unique circumstances for their clients doing the GPRA. First program I'm going to talk about are the peer recovery coaches that are at federally qualified health centers, urgent cares, or other primary care settings. So we've created this flow chart. Do I need to conduct an intake GPRA for this client to help the peer recovery coaches decide if they need to conduct a GPRA on the client? Basically, if the peer recovery coach is going to see the client more than once and have an ongoing service provider relationship with the client, then they should conduct a GPRA. This is considered treatment by the SOR grant and what does require that GPRA data collection. However, if the peer will not see the client more than once, or will not be likely to have an ongoing service provider relationship with the client. This is considered outreach by the SOR grant and does not require a GPRA data collection. If any of your peers or providers have specific questions about an instance with a client that they are seeing, feel free to email the GPRA@wayne.edu so we can help troubleshoot whether you need to conduct a GPRA for that client or not. Jail-based programs may not have access to the internet or technology during the time that they are conducting an interview. People that are in jails should be recording client data on a paper GPRA form and then entering the form into Qualtrics within a week of the interview. This is also true for mobile care units that might not have access to the internet or in any time that you have limited internet access. This is why we recommend you have a paper GPRA tool as a backup and then find a way to enter it into Qualtrics within a week of the interview. For recovery homes specifically, if SOR funds were used to make any improvements on the recovery residents, all recovery home residents or clients must complete the GPRA. For more help, we are available at GPRA@wayne.edu. That email is monitored throughout the week and on the weekends. We also post updates and resources on our website, mygiprainfo.org, and you can find us at either of those places.